Yeah, you and I, of course, are parents, and we always want to protect our children, especially when it comes to getting sick. That's a big concern when you have little ones like I do at daycares and early learning centers.
So now this morning, our Lauren Kostick is looking into what's being done to keep your kids safe while you're away.
The day early learning centers are finding ways to adapt. The centers have remained open throughout the pandemic, being there for essential workers. So early on, the team had to develop a new system.
I can't say that we were always wiping down the phones and we were always wiping down the doorknobs and like sort of things that, we did those on occasion, but now we actually have a system where the teachers are doing that and working with our maintenance and our cleaning teams to do those on a much more frequently basis.
Christine Bell is the vice president of Day Early Learning, overseeing how the centers operate. Some things were easier than others.
Obviously, social distancing small little ones is a much more of a challenge.
But when it came to washing hands, well, that was easy. They also keep classes together to help with contact tracing. Masks are required for team members and recommended for children 2 and older. Playgrounds are sprayed down between groups. Temperature checks are given at the door, and there is a daily deep cleaning of toys and materials. Bell says the hardest change is limited visitors. That includes parents.
We've really been trying to work hard on how we can still stay in touch and engaged with the families when they're not getting to see their child's teacher every morning.
To reduce sharing, every child also gets their own school box of supplies. But for other toys that are harder to share, the staff cleans those at the end of the day.
And golden delicious.
New safety practices also means more money. Unexpected costs like new dishwashers and washing machines and new toys.
Now we're throwing all these things in the dishwasher and cleaning them so much that they're starting to come apart. So now it's like, okay, now we're gonna have to be replacing things.
Bell says 80% of the students have returned since March. So far, they've had 14 cases, mostly parents and staff members. Only 2 children have tested positive, but of those cases, there were no outbreaks.
It's safe, and we are being very diligent about making sure we keep it that way.